My name is Kristen Stevens, as Joyce said, thank you. And I'm Program Manager of Education and Marketing at Harkness Center for Dance Injuries at NYU Langone Health here in the city. I work with a phenomenal team of physicians, physical therapists, and athletic trainers. I was a professional ballet dancer and arts administrator, and I'm a dance educator. I've lived in several US cities and abroad. I'm a mother, and a year and a half ago, I had a total hip replacement. Like many dancers, and like all of you, my path has been a series of transitions. From training to performance, student to professional, performer to educator, younger to older dancer, and return from injuries, surgery, pregnancy, and illnesses, the periods of uncertainty and how we respond make up the fibers of our career longevity. Dancers are uniquely both artistic, spiritual souls and pragmatic by the bootstraps creatures, qualities we have heard about repeatedly throughout this symposium. Today I'll start with some reflections and then turn to a pragmatic call to action, a community resource plan. Here is our roadmap for the next 10 minutes. This photo is from a children's book called In Between. The book is filled with images of transition. Having come through a major surgery, this one especially connected with me. Children's literature is filled with themes of change and transition. In this story, Owl wants to be upstairs and downstairs at the same time. Running up and down, he exhausts himself. At last, he realizes it's impossible to be in both places. He sits down to rest in the middle, a transitional place, until he can decide. In cultural anthropology, liminal periods refer to times of ambiguity, darkness, and even death. They are transitional periods that bridge one state of being with another. After dancing in ballet companies for 15 years, I began navigating university, technology, work, housing, and financial insecurities. My once linear life became winding. I realized that transitions are embedded in living, and for me, they would come with fear and anxiety. But over time, I found that in those transitional times of uncertainty and discomfort, there could also be a peacefulness, perhaps similar to the peace that comes while choreographing. In the point of that liminal creative space, when you hit your stride. I'm honored to be in the company of all of you, models of embodied bravery and resilience through transitions. As dance educators, we must teach our students that wellness can be aligned with dance training, not at odds with it. But who gets the luxury of career longevity? What barriers exist to a long, healthy career as well as life? What traumas have we experienced, and how do we confront those as we stand before our students? This slide is filled with stories of transition shared by our patients and students. I'm gonna cough while you look. Sorry, getting over it. It has been wonderful to hear some of your stories of transition just over the last 2 days. While these bubbles are in no way all-encompassing, they do reflect common themes experienced throughout dancers' lives. For me, most recently, I had to accept that my hip replacement surgery was a loss, but also a rebirth. Here is a healthcare lens that allows us to consider the dancer as a whole person. We know injury prevention, recovery, and overall health have better outcomes when we address our biological as well as psychosocial needs. At Harkness Center, we meet dancers in all career stages and in all sorts of transitional states. Those with temporary injuries that will heal, chronic problems they will learn to manage, and some coming back from pregnancy, surgery, and other life events in which they're learning to live in a changed body. All of them have physical as well as psychosocial needs. We'll keep this model at the forefront of our community resource plan. The community resource plan came out of a 12-week course that we teach for dance educators in partnership with the National Dance Education Organization. It's a pragmatic strategy for systematic support and change. Our primary goal being to continue the work of infusing dance education with the notion that dancers can be well. We don't have to suffer through our careers and lives and all the transitions they bring. This is our what slide. A community resource plan is a hub of information incorporating the 3 biopsychosocial areas we just discussed. It prioritizes community partnerships, but also guides the dance educator who may be unsure where to begin. This is our why slide. We can assume that our classrooms are a tapestry of diverse races, ethnicities, experiences, and economic backgrounds, as well as varying access to health and wellness resources. By creating a neutral, accessible hub, we take some charge of leveling the field. Further, we prioritize our desire to train our dancers to be healthy, resilient humans, to understand why we need balance between dance training, academic school, peer pressures, family situations, world stressors, etc. On the left is a graph showing social determinants of health. On the right is a list of considerations as we craft our plan. So dance medicine evolution, the field of dance medicine started in ballet and modern dance. There are historical disparities in access and participation that we must continue addressing. When thinking about healthcare for dancers, we must prioritize our dance cultures, traditions, expectations, and norms. Not every healthcare resource will serve every dance community the same way. Location, how and when will our students reach the resources? Financial, we must understand the costs of our resources and where we can find financial support. Prior experiences, has a student or their family had a past negative experience with healthcare? We must be sensitive in our dissemination of resources. And social network, parents work, they have other children and adults to care for. Families and friends have preconceived biases or ideas about health. We have our what, so we've done our what, our rationale, and our additional considerations, so we'll jump into the template. Again, we'll keep the biopsychosocial model in mind throughout our resource compiling. As we develop our hub of resources, we'll keep in mind location, community needs, reach, and format and distribution. Here is a simple checklist for thinking about your geographical location and your specific dance community. We need to think of our location because some of us live and work in areas of endless resources where the challenge is finding the most relevant ones. For others, the challenge is more about finding and even developing potential partners that may not have worked with dancers prior. We need to think about our community because needs will differ based on setting, ages, backgrounds, and so forth. In thinking about dance injury prevention and longevity within your setting, what needs exist? We can think both of our organization and of the community it serves. 3 areas we at Harkness often hear are most challenging are getting buy-in of students and parents, faculty training, and access. So we're ready to compile. Think about the healthcare providers that you'll want in your hub, but also the practical things your dancers will need for safety and comfort. Healthcare workers on your list should represent all areas of the biopsychosocial model. The best ones will already use this approach. Make sure you include physicians. They are the only stakeholders who should be diagnosing. Take advantage of existing infrastructure. Who provides healthcare for your local professional dance company, sports teams? What parents are potential resources? Who might offer financial or in-kind donations? When seeking sources, aim for large reputable institutions like medical centers, universities, governing and membership bodies. Make sure the source includes sound references. Preference websites and articles over social media posts. These state, national, and international organizations can offer wonderful sound information and resources, including directories of practitioners by geographic location, conferences, and open access resources. These are wonderful starting points because they're comprised of respected members of the dance community. Here are some ideas for laying out your plan. Aim for a minimum of 10 relevant sound resources. Consider the best ways to organize it based on your community. Will they look at a posted flyer, read an email, listen to a talk about the hub? Identify your stakeholders and your partners in dissemination. Is this for college students, faculty, young children, in which case parents will be critical partners? This will be a living plan and an opportunity for the dance educator to continually layer their dance medicine knowledge. So some successful outcomes achieved by the dance educators that have taken our course include discovering a range of service providers and making personal connections with professionals who either have experience with or interest in working with dancers. We actually require they call at least 2 of the sources and get a personal conversation going. One teacher shared, "I spoke with the daughter of our studio owner, who is a Rolfer. She's treated a few dancers from the studio with Rolfing lasers, but told me she wishes dancers would come to her more often." The takeaway being, you never know who's right within your own community. So I have 3 primary future goals: to see access to dance medicine resources continue to increase, and for dance educators to feel more empowered to support health and wellness goals, and for dancers across disciplines and socioeconomic strata to gain resiliency as they navigate life's transitional periods. We hope that for those in need of guidance for achieving these goals, this community resource plan template can be a concrete and accessible tool. Thank you. That's my. Thank you. Like questions after or now?
You can do it now.
Okay.
You have time.
Yeah. I thought I had the time, and if the slides are shareable, that's fine, so that people actually have all the lists. So.
Yep.
I know that this audience, when I started meeting you all, I thought, some people might be able to use this and some might not, but what I thought was the most interesting was the themes that I was already planning about the transition and the challenges and the similar obstacles. I thought, wow, it's really connected, and the healthcare piece of it is sometimes hard in the arts, like having worked as a dancer first, and now and also Matthew Farmer yesterday when he was talking about just being in spaces he wasn't used to being in. I certainly felt like that when I started working in a healthcare institution. It wasn't what I was trained for. I was trained to be an arts administrator, and then it was this job where it's like the job of an arts administrator, but within a healthcare setting. So, so hopefully some of this maybe is. Yes.
Is Harkness still doing the free dancer assessments?
Yes.
Oh, yeah,
we-
yeah.
yes.
Can you mention that?
Yeah, that's a
Sure.
good question.
So we have a wonderful free, and I'm happy to send resources to all of you. It's a free injury prevention assessment program, and we offer it in person and also virtually. So your students anywhere can call and schedule a 1-hour session with an athletic trainer, and they get a full screen, and they can get referrals or advice if they have questions. So that's a great program. Thank you. Yes.
Thank you so much. I know the work you do is so amazing. I think